strategies to improve or to run successful private practices, and how to, provide that practice experience that justifies the demand and the reason why patients would come to you, which typically, if we look at it, is a point of concern for many organizations. In healthcare, competition between providers can only be on cost and quality. And when we look at things from that point of view, these are the things that drive the patient's decision making. So when we're looking at things around how do we improve our practices or run successful practices, we need to understand that this is about how much value we're actually delivering to our users. And this value, when we look at healthcare, is tied to two key things: the cost of services, and then the cost, the value or the quality they get from those services. And when we look at quality, it's a very, very, very broad area, but it would be nice to just generally speak about what are the key things to put in place to be able to deliver a cost advantage and a quality advantage that will put you in the clear, and the other things that need to be done to ensure that you're doing what you set out to do. So first thing, when I say to businesses or practices in healthcare, is that the first thing is that you actually need to be very clear on why you are running this practice and why you are doing this business, right? It's healthcare, it's healthcare, it's healthcare. A lot of people come in for the passion, a lot of people come in for, the need to do good, but is that enough? You need to run healthcare practices like a business. And with every business, there needs to be a very clear vision as to what you're trying to achieve. And when you have that vision and that clarity around the vision, the next step of things is, really understanding, and setting out a mission statement. Why are you doing this? Why are you actually trying to achieve this vision, right? And how you're going to go about achieving the vision is, down to your strategy. So without an overarching vision, it's almost impossible to have clarity on how you're going to take the next steps. Now, if your vision as an organization in the private practice is to provide the highest quality services around, then you might not pick cost as a major thing, as a barrier within all your strategic inputs and outputs. You'll be looking at things that would make sure every patient or everybody who comes in contact with your organization can feel that you guys have a priority of focus on quality, right? On the contrary, you might be, looking out for cost as a major thing, as a major source of advantage, right? If you wanted to offer the most affordable services uh, around, then as your vision, then the strategy to doing that would also change. It would change and affect the sort of staff you hire. It would affect the sort of materials you use, the inputs you use. It will affect your inventory cycles. It will also affect how long you can wait for people to pay you. So all those things are very important as things to hold at the foundational phase, to understand what are we trying to do. And these are tied to things like understanding the market you want to serve, because the market is the most important thing. Like, what are the characteristics of this market? Who are the customers? What can they pay? How much are they willing to pay? What sort of things do they associate with quality? What are the metrics that they use to gauge whether they've received value from healthcare or not? I think one of the major things to really do beyond that is now taking that to the strategic level, to be able to inform the type of people you're going to employ. Now, people are very, very important, especially in the service industry, which we are in healthcare. What type of health professionals do I need to hire to deliver the value that I'm trying to get across to my clients? If affordability has been the primary focus for me, then am I going to be employing a lot of tax shifting, retraining some staff, or am I going for if cost is not really the issue to profit maximization, do I need to go and bring some branded names that I pay a lot of money to be able to um, deliver the brand promise that I'd set out. So all those things come into place into the selection of the people that would run the organization or deliver the services at that organization, right? So what we're advocating for when we talk about processes is to reduce the variability that can be associated with services and delivering certain functions. Like the honest truth is, with healthcare, we want to get the same results every time when we do certain activities. Like if I'm going to do a circumcision for a child, there are reasons why there is a procedure for circumcision and there are processes involved to guide me to ensure that each time I do the circumcision, I can get the same result every time. Now, to reduce variability across service delivery, it's really important to engineer processes that would guide the people and also guide the sort of decisions those people can make while delivering those processes. It's also important to be able to track these processes for their performance, because processes are, you know, tied to specific outcomes, right? And some of those outcomes in healthcare, I think things like process time. How long does it take for us to run this process, such that we are looking at the different outputs for the different people that you set at those locations. So is it the process that has an issue, or is it the people that have an issue? If you don't have processes and you're not measuring those processes well, it's almost impossible to tell which is which, right? So your process should have very clear handoffs, very clear linkages, and you should be able to continuously review those processes and the way the performance of the people and the process itself to see opportunities for improvement. Now, honest truth about processes is that there will always be opportunities for improvement. And can these opportunities be scaled across the process and all of that type of stuff is what you'd be concerned with. So most times, what is really important from this end, I think, is being able to get your people to understand why those processes are in place and how those processes generally tie to delivering the business's goals and strategy. And then the last part that you'd want to consider at this point, really is the technology that will be deployed at your practice. Once you are clear on your processes, then you now get to technology as an enabler, as something that I can accentuate the work you've been doing, the efforts that the people are doing, putting in the processes. With those two things combined, and you now layering technology on it, things can work a lot faster and you can deliver greater value. Now, really, when it comes to technology and selecting technology, it's really about what you are trying to achieve. Right, so your processes have been giving you specific outputs from your processes. For example, you've realized that waiting time is roughly about 30 minutes to see a doctor. Your waiting time for ultrasound scan is about 25 minutes at your center. What can we do from the technology point of view to reduce this waiting time further? If we're using EMRs as opposed to files, would that make things easier? Would the doctors be able to see patients faster? Would a different type of ultrasound scan machine, which processes things faster, help? So you start to consider different types of technology to fit into the existing processes in a way to improve them, essentially. So once you are very clear on your people strategy, the sort of people you need, you're clear on your processes, and you're able to maintain a certain level of quality and repetitiveness when it comes to process execution without a lot of variability, which is a very key thing when you're looking at your process management. The next thing is just to add essential technology or enabling technology to that entire thing, and you have a functional organization. As a functional organization delivering value, two key things come up after that. How do you manage your demand, and how do you manage your supply? Demand being the major thing that drives businesses. You really need to be able to aggressively figure out where the demand is. We spoke earlier about the market, and the market being, the people who are ready to pay for your services, and the addressable market, generally being, whether you're focused on a local community, or you're trying to figure out, obviously, using your technology to pull clientele from different places, or in a case like Nigeria, where you have HMOs and you want to be able to at least target them. So, targeting HMOs is purely business development. Other areas to do business development would be, targeting companies directly, doing some digital marketing, for example. But to focus more on the HMO side of things, the HMOs in Nigeria and the health insurance companies typically do a bulk of the payments that hospitals receive, despite the high out-of-pocket payments. I think out-of-pocket payments in Nigeria amount to about 76%, or rather 76% of the population are paying out of pocket. However, most of the payments that hospitals receive as bulk payments come from the insurance, which plays significant role in sort of working capital that hospitals get access to. So doing some core business development to be able to get some clientele from the insurance companies is a very key step towards, achieving success in private practice. So this can either be done directly if you're able to do the rounds yourself, meet with them, have a few phone calls with their provider management teams, or contract a business development agency that has experience working with HMOs and health insurance to help you do your negotiations. But with the negotiations, it's also very important to be able to revisit those negotiations frequently. As you're doing more volumes for the HMOs, there's more reason to go back and revisit the numbers and the rates that they're giving you. And demand management is also very important, when we look at how do you manage queues at your place, appointment bookings, things around making sure that the experience is great, because people are coming to your place because you've offered, you've made a certain proposition to them. Maybe you've told them that they would get seen quickly, or you're giving a guarantee that your rates are not too high. So when the word gets out, there's a high likelihood that people will rush to your place. So while people are there, you also don't want your demand to outweigh the supply, and that's when people have to wait. So as much as you're doing your demand management, you also need to make sure that your supply is there. Now, supply management really is inventory management, right? And inventory management, I'd like to, in healthcare, broadly classify even your human resource as human inventory, because sometimes most of the inputs you need from an HR point of view are health professionals who don't fully work for you. So you need to be able to get a dermatologist to see X number of patients. It's more expensive if you need to bring that person on different days, but if you can pull all the patients to one day, things get easier. So all those kinds of things are things you need to think about. With the inventory management, there's a lot of value in being lean. But we look at the peculiarities of a place like Nigeria, where yes, you want to be lean, you don't want medications to expire in your store. So you need to be able to partner with organizations who can bring those things when you need it. So moving towards a more of a just-in-time type of procurement. However, when we look at the reality and the way our things are structured currently with low input from a technology side in most practices, it's very difficult to have the data aggregated to be able to make informed decisions that this is the amount of stuff we need to order every cycle, which accentuates the importance of technology in this whole space, right? Organizations need to start moving towards when they can predict their inventory and use that prediction to effectively reduce the cost of just having too much inventory on their shelf or in their stores. And that essentially ties the supply management side of things to ensure, to the demand that you are getting, ensuring that you're not over providing or over processing, over preparing for things that you might not require. The next part there is keeping up with trends and being able to establish a very strong feedback and quality assurance system. Because beyond managing your demand, your supply, you need to also manage your internal environment, which is tied to keeping that quality that you've promised to the customers at the same level, or even improving it and making it better. And to get all this done, you can't achieve anything improvement or even assurance or feedback without measurement. So you can only improve the things you measure. So it's important that as an organization, you're setting the right KPIs, especially when you're looking at things from a process level and a performance level. People would always try to slack. And if you do not have performance indicators for all the activities that people are expected to do during their work periods, what you would see is that things will go south, right? So you need to be very clear as to what you are measuring, and to an extent, let everybody know that their activities are being measured. What helps in most organizations is to have a very clear value stream map, so that you've mapped out all the things that create value in this organization, and everybody knows how every activity they do contributes to value for the patients that you are seeing. And that value really can be as simple as, oh, we want to actually have faster processing for our claims, or we want to have faster billing so that people don't have to wait to get the bills. We want to improve the experience of our people on the wards. We want to have less accidents occurring in the hospital. We want to be able to reduce the turnover of our staff. So there are a lot of things that you can measure as KPIs, that would help you achieve this sort of we want to type goals. And it's important for organizations to constantly meet and strategize and set this we want to type of goals and objectives. And all of this, all of this is kind of impossible without achieving your funding targets. And funding becomes a real issue because, one, you need capital expenditure to buy equipment, you need capital expenditure to be able to get stuff done, but mostly you need working capital, because most times when you're at this stage thinking about things like this, you've already set up, you're established as an organization. It's really an issue of my day-to-day financing, my day-to-day operational cost. How do I get this thing sorted? And you want to get that money from business, but that can be tough when people are not paying on time, or you're not charging enough for your business. And that can only come when you look at the revenue and then you tie that to the cost and then do those comparisons. So one of the key things I know would destroy most practices, or not make the practice work functionally, optimally, is the inability to actually secure working capital. And working capital is the money you use to, make sure that you are ready to provide services for people. And with healthcare, you have to be live 24/7. Or except you're a clinic that is closing at a specific time. But when you are on as this is my working hour, you can't really avoid being prepared to service people, and you don't even know what the people are going to come for, right? So that's where really getting payments on time and all of those things become very clear stuff. And you would start to see that this is also the point, from even from an HMO point of view, where a lot of fraud starts to set in, because people are trying to get their money. They know there will be delays, or there might be delays in getting their reimbursements, and they start to find different ways to pad the funds, or to layer other claims on it. And I'm sure this is a very interesting area for Curacel to pick up on. I would just like to summarize and end with one of the key things for success is really being user driven in all the strategies that we're making. And this requires a certain level of innovation. Being very clear as to what you want to do would help you define everything from ground up. A successful practice has to be designed for success. I can give a few examples of scenarios where the design has been very, very crucial to their growth and their success as an organization, and it ties in all the things we've spoken about. You need to be very innovative as to how you find money to keep the business running, how you can access equipment financing from different different avenues, avenues to pay, lease to own, to pay upfront, to pay in installments. All these things are available and can help you manage the financial requirements of running a successful practice. But most important thing in running a successful practice, as I said earlier, is having a very clear vision, having a clear mission statement, picking the right people, creating the right processes, and then choosing the right technology to get you going. And once all that is done well, it's important to focus on demand management, which is your business development and making an effective marketing. And then supply management, which is making sure that the inventory you require for services are being procured at the right rates that can contribute to the sustainability of the business. Measuring feedback and ensuring quality assurance would also help you stay on track. With regard to examples, I really like to speak about the NH hospitals in India. So they had a vision to provide affordable cardiac care, and their mission was to make sure that people can get cardiac care services at 1/10 of the global average price. Looking at all of this, they started to rethink the people strategy. Like, okay, if we're going to do this, we cannot have the any waste in our resources. So having a cardiologist, cardiothoracic surgeon rather, operating and doing some parts of an operation that they don't feel is efficient were things that they were trying to remove. So clearly speaking, directly speaking, in NH hospitals, or rather generally, if we're going to do open heart surgery as a scenario, it's possible for that surgery to be done by a cardiothoracic surgeon from, opening the patient to closing the patient. And that will potentially take 3 hours. Now, if this cardiothoracic surgeon is spending 1 hour opening up the patient, 1 hour working on the heart, 1 hour closing up the patient, we can realize that the most efficient 1 hour is the 1 hour where the cardiac surgeon is working on the heart, because that's what we're really paying him for. We're paying him $60,000 per month. We really are paying him for the time he's going to work on the heart. So why are we wasting his time to open the patient and close the patient? So they've looked at that and they said, who else can we use to open the patient and close the patient? They found that we can use somebody way cheaper who has the skill sets to open patient and close the patient, such that every time the cardiothoracic surgeon comes in, he has patients opened for him and he just does 1 hour on each patient. So a procedure that would have taken 3 hours for him to finish one case, right? Now he's able to do 3 cases in an hour. Now that definitely helps them to maximize all the resources that they provide, they need, or the supply that they've been able to accrue to deliver services. But they're doing a bit more on the demand management. One, they're marketing purely that they are a cardiac service center. So they're not getting people that need bone surgery, right? So they're really streamlined. Beyond being streamlined, they also want to make sure that at least 6 people are waiting for surgery before they bring the surgeon in. That way, they're able to do 6 cases in 2 hours. Sorry, 6 cases in 6 hours, as opposed to people coming in trickles and them not being able to maximize that cardiac surgeon's time. So the moment the cardiac surgeon signs up in the morning, he knows this is a 6 hour shift. He knows he's going to do 6 patients. And then from that point on, the next day in the evenings is reviewing his patients. So the processes and the way their theaters are designed, you can imagine that theaters should be able to have 6 theater rooms that are connected in a way that the surgeon can pop out of this one, change his gloves, scrub in, go to the other surgery, right? So all that infrastructure design, all the technology they use for monitoring has to be, thought about from scratch. They won't start that business, get to the point where they realize, oh, we can maximize the output by making the surgeon do only the hard cases, and then now start thinking about how they are going to increase the volume and start to create a new block, a lot of that. All those things had to have been calculated before they even started things, right? So I just gave that example to be able to put things into perspective. They probably have to pull almost all the cases they can get from all the insurance companies that they have or work with, because they know they can deliver that value, but they need the volumes to be able to deliver things at that cost, right? So these are different avenues and ways to look at building a successful practice in healthcare. And of all these things, one of the most crucial aspects, again, I would have to resound, is being able to collect your money whenever you need, whenever you've provided services.